Hi, my name is Megan Ryder McGuffin, and I am a graduate nursing student at West Texas A&M University. Today I will be, bless you.
Thank you.
Today I will be performing my head-to-toe assessment, bless you,
Thank you.
on a 31-year-old male who is here for a general physical. Prior to this, we've already done the interview and we have done the general survey in which the patient has informed me of his past medical history, his family medical history, his surgical history, as well as his immunizations and his allergies, which he has no known drug allergies. I have also checked his vital signs, and we have also done the smell and eye chart, and everything was good and within normal limits there. I've washed my hands. During the interview, I've also did a general survey of the patient. In this, I'm just noting the color of his skin, whether he's cyanotic, jaundice, or normal for his ethnicity. I'm also looking to see if he is in any acute distress. This could be in acute pain or respiratory distress, but I'm also noting this. My patient is calm and comfortable, not in any distress. So with this, we will start my head-to-toe assessment. So the first thing that we will be doing is starting with the head and his neck. So first I will be looking at his hair, noticing if there's any bald spots, thinning of the hair, brittle hair, anything like that that could note any endocrine disorders. I'm also going to look at the scalp. I'm going to tilt your head down a little bit. I'm separating the hair, looking at his scalp, noticing if there's any scaliness or lesions, and everything looks good there. Next, I'm going to feel his head. I'm feeling for any depressions, deformities, noting any tenderness, and everything is good there. So you can look back up. Thank you. Next, I'm looking at his eyes, nose, and his mouth, and everything is midline. With his eyes, I'm going to look at the conjunctiva. And it is pink. I'll also be looking at the sclera, which is the white portion of his eyes. We want that to be white, which his are. If they are yellow, that could mean dehydration, or it could mean jaundice from alcoholism or many different other things. So we want to make sure to note those and look at that. So next I'm going to test his pupillary reaction. I'm going to shine this light in your eyes if you will just continue to look for it. Good. Pupils are equal and reactive to light. Next I will grab my ophthalmoscope. And with this, I'm just looking at the optic disc. I'm noting any papilledema or any abnormalities in there. I'm going to rest my hand on your forehead while I look in your eyes. Everything looks good. Next, I'm going to have you follow my finger with just your eyes. Good. And with this, we're just noting any nystagmus or jerking of the eye movements, which he did not have any. So after the eyes, I'm going to go ahead and move on to his ears. I'm going to look at the external portion. I'm going to feel them, note if there's any lesions, deformities, lumps, anything of that sort. So there's not, everything is good. So next I'll get my otoscope. And I will look at his internal ear. So with the adults, I'm going to grab the top portion of his auricle, and I'm going to pull up, back, and out away from the head a little bit. His tympanic membranes are pink. The cone of light is at a 7 and a 5 in his ears. Everything looks good in there. Next, I'm going to do the whisper test. So with this, I'm going to stand behind you, and I'm going to whisper something, and I want you to repeat it after me, okay? So with this, I want to stand about 2 feet behind my patient, And with one hand, the ear that I don't want to test, I'm going to cover my hand over the auricle and I'm going to kind of make a little moving motion. I'm going to test your left ear first, okay?
Okay. Do what?
Can you repeat what I said, what I whispered?
Sorry, you have to do it again.
Okay. Ready?
69.
Good.
72.
Perfect. Okay. Next, I'm going to look in my patient's mouth. I'm going to shine a light in there. Open. Thank you. Stick your tongue out for me. Say ah.
Ah.
Good. His tongue and uvula are both midline, which we want to see. I'm now going to have you open your mouth a little bit and move your tongue from side to side so I can look at the sides of it. Good. And here I'm just noting any ulcers, lesions, anything of that sort. This could show cancer or any some other possibility. So I just want to check that he has no ulcers or lesions. Next, I'm going to test his gag reflex. Gag reflex is present. Perfect. Now I'm going to look in my patient's nose. It is pink. There is a little bit of drainage, but it is clear. I'm now going to check his sinuses. I'm going to check him for any pain or tenderness. So first I'm going to check his frontal sinuses. Any pain or pressure or tenderness?
No, ma'am.
Good. So with this, I'm just checking underneath the bone and pressing up, making sure not to press into where his eyeballs are. Next, I'll check this maxillary. Any tenderness?
No, ma'am.
Good. Next, I will check some of his lymphs. With this, we're just checking for any lymph enlargement or tenderness. So I'm going to check his posterior auricular, his preauricular, his tonsillar, submandibular, and submental, supraclavicular. I'll go ahead and check his axillary on here. Any tenderness?
No, ma'am.
Good. So here we can also check his tonsillar mandibular joint. So with this, I'm going to place a finger right in front of his auricles. I'm going to have him open and close his mouth. Open and close. Good. One more. And then move your jaw from side to side. Open and move your jaw. Any tenderness or clicking?
No, ma'am.
Good. And I don't hear or feel any clicking on that either. So next I'm going to have him, I'm going to go ahead and have you turn a little bit so I can take a look at your back. Thank you. I'm going to place my hands on either side of his spine and I'm going to have you breathe in and out. Good. And with this, I'm just noting, I'm washing my hands to see how they expand with his back to make sure that everything is equal and expanding the same. So next I'm going to percuss his back. We're noting any dull spots. Good. I'm going to listen to him. And with this, we want to hear clear lung sounds, but we're also listening for any adventitious lung sounds. This could include crackles or wheezing or rhonchi. here we're also going to, since I have his back here, I'm also going to percuss where his kidneys are to see if he has any tenderness there. Any tenderness?
No, ma'am.
Good. I'm going to have you turn back around. So here I'm going to inspect the front of his anterior chest. I'm going to check for firmitis. I'm going to use the palm of my hand and the pads of my fingers. After that, I'm going to go ahead and percuss. Good. I'm also going to auscultate the front of his anterior portion of his lungs. And again, we're just noting any adventitious sounds here. I'm also going to listen to the lateral. If you can move it on this side. Good. So while I'm here, I'm also going to listen to his heart. So I'm going to listen to the right second inner space, that's the aortic, the left second inner space, which is the pulmonic, the left ventricular space, which is the tricuspid, left of the sternal border, and the right ventricular space, which is the mitral valve. While my patient's in this position, he is more slender, so I can check to see if I can feel his PMI from this position. Which I can. I'm then going to have you lean forward for me a little bit. I'm having him lean forward so I can listen to the base of his heart. What I'm listening for is I want to hear S1 and S2 sounds. I'm just checking it's easier for him to sit this way. It brings, if he has any murmurs, it makes them more noticeable for me. Perfect. And I hear S1 and S2 sounds. So now I'm going to go ahead and at this time I would have my patient lie back on the bed. So we're going to lie on our pretend bed, and I'm going to have you lie down for me so I can inspect your abdomen. Okay. So first, I'm going to inspect my patient's abdomen. With this, I'm just trying to see if I can see any masses or see any pulsation in his abdomen. And then I'm going to auscultate it. And he has active bowel sounds. I'll have my stethoscope right here. I'm also going to listen to his aorta and iliac and femoral arteries. Next, I'm going to percuss his 4 quadrants. And then I will do some light palpation. Any tenderness?
No, ma'am.
Good. Next, I'm going to check his liver span, so I'll start at the umbilicus and work my way up. Good. Next, I can try and palpate the spleen, which I cannot palpate, which is completely normal. I will then try to palpate his kidneys. So I'm going to place one hand under his back. Any tenderness?
No, ma'am.
And also on this other side. Tenderness?
No, ma'am.
Good. So while I have my patient lying down, I'm going to go ahead and check the range of motion of his legs. So first I'm going to have my patient raise his leg and keep it straight and dorsiflex. Do you have any pain?
No, ma'am.
And on this side, dorsiflex, pain?
No, ma'am.
Good. So first we'll check the range of motion of his hip. I'm going to raise your leg, keep it straight for me. Extension. We're going to abduct, adduct, flex, internal rotate, and external rotate. And while I have him here, I'm also going to just go ahead and do his knee. So his knee is flexed. We're going to go ahead and do internal rotation and external rotation and extension. We'll then move to his left side. We'll go ahead and do extension, abduction, adduction, flexion, internal rotation, and external rotation. Go ahead and keep this flex for his knee. And we'll do internal rotation, external rotation, and extension. So with his ankles, we'll check range of motion and strength at the same time. I'm going to have you flex your feet, and at the same time as you flex them, we're going to try and push against them. So keep on flexing as hard as you can. Good. And now extend them like you're pushing on a gas pedal. Good. And while I'm down here, I'm also noting any abnormalities to his legs, any varicosities. I'm noting the hair on his legs, if there's any patches, and his all look good. And I'm going to help you back up. Good. And then you can have a seat again. Now, since we're doing the range of motion and strength, we're also going to do the upper portion of his body. So we'll go ahead and start with his neck. I'm going to have you try to reach your ear to your shoulder on both sides. Good. And the other side. Good. And this is the range of motion. Now I'm going to put my hand on your face. I'm going to put it on the left side of your face. I want you to turn left against my pressure. Good. And the other side. Good. Now we'll check your shoulder strength. I'm going to place my hands on your shoulders and I want you to lift up while I push down. Good. Next, we're going to check the range of motion for his shoulders. So I want you to place them out in abduction, adduction, flexion, extension, external rotation, and internal rotation. Good. Now we'll check your elbows. I want you to flex your arms. And I'm going to try and pull down and don't let me. Good. And extend them. Good. Squeeze my fingers. Open and close your hands. Good. And while I'm up here, I'm going to go ahead and check his pulses. I did not check his carotid pulse earlier, so I'm going to go ahead and do that now. So with this, I'm also going to take a listen to see if I hear any bruise or any whooshing sounds. and everything sounds good. I'm going to now check his brachial and radial. Popliteal. And dorsalis pubis. Good. I'm going to take off his sock, and I'm also going to take a look at his feet. So with this, I'm just looking for any abnormalities. His toes are pink. His cap refills less than 3 seconds. I'm also going to look at the bottom of his feet. He doesn't have any sores, nothing going on there. With diabetics, this is very important because they lose a lot of sensation in their feet, and if they get a sore, they may not know it, so they need to be taught that it is important for them to check their feet. I'm also going to check the cap refill on his hands. Less than 3 seconds. There's no clubbing, no cyanosis, so that's good. I'm going to have you place your hands on your knees. Now I want you to pronate and supinate your hands. Good. Now close your eyes for me. I'm going to have your hand. I'm going to draw something with my finger, and I want you to tell me what it is.
8.
Good. Keep your eyes closed. I'm going to place an object in your hand, and I want you to tell me what that is.
A key.
Good. Okay. You can go ahead and open up your eyes now. Now I'm going to check for deep tendon reflexes. The first one I'm going to check is the tricep. I'm going to raise your arm, and I want you to relax it in my hand. The same on this side. Good. Thank you. Good. Okay. Now I'm going to go ahead and have you stand up for me. I want you to close your eyes. I'm going to check you for your balance. Good. Excuse me.
Bless you.
Thank you. I'm going to have you bend over as far as you can and try and touch your toes. Now with this, we're checking the spine. We want to make sure that the spine is midline. If there's any curvature of the spine, that's known as scoliosis, and we don't want to see that. Do you have any tenderness?
No, ma'am.
Good. Come up halfway. Right there. The spine is still midline. Any tenderness?
No, ma'am.
Good. You can go ahead and stand up for me. Next, I'm going to check his gait. So I'm going to have you step toe to heel. Come on this side up here. Okay. Good. Now turn around, and when you walk this way, I want you to walk on your toes and then on your heels. Good. Okay, and you can take a seat. So now that that portion of the head to toe assessment is finished, since he is a male patient, I would then perform a male genitalia assessment. And so with this, we would check the shaft of his penis for any ulcerations, lesions, any abnormalities there. If he does have his foreskin intact, I would have to pull that down, inspect, and then before I went on, pull the skin back up over. I would palpate it with my thumb, my forefinger, and middle finger. I would palpate between that, noting any masses or anything abnormal. I would then move on to his scrotum and his testes, and I would also palpate with my thumb and forefinger and middle finger, noting any abnormalities there. When I have this patient in this position, I can also note any inguinal herniations. I would palpate all of that area. For the rectal exam on the male patient, I would have him standing up is one option, and he would be bent over with his hands on the exam table. The other option for the male patient would be to be in the left side lying position with his hips and his knees flexed. With this, I would have my gloves on. I would inspect the anus and the rectum. I would then lubricate my forefinger and place the pad of my forefinger next to the anus. The sphincter will constrict, and whenever the sphincter loosens, I would press my finger into the male patient's rectum towards the umbilicus. I would then rotate my finger clockwise to feel the full rectum. With this, I would also check for my patient's prostate. The male breast exam is typically fast. You want to go ahead and look at the nipples, the areola, noting any masses, lumps, tenderness, any abnormal discharge from the nipples. For my female patient, the breast exam would be a little bit longer. You would still note the nipples, the areola, any discharge, but you would also palpate their breast in the vertical strip pattern. So you would start at the nipple, work your way up and down and up, going out towards the armpit, and you would do the same going in towards the sternum. For the female genitalia assessment, the female would be in the lithotomy position. I would first look at the external genitalia, so I would make notice of the labia majora, labia minora, noticing any redness, tenderness, swelling, any ulcerations, lesions there. I would then get a speculum that fits the size of my patient and the age, and I would lubricate it and insert it into my patient. I would then look at the cervix. Depending on how long it has been, they will get a pap smear done. So with patients from the age of 21 to 65, it is every 3 years. And so with this, there are 3 approaches to checking the cervix, and you can, the broom is one of the most common ones. So we would do that, and then after that was looked at, I would remove the speculum. I would then insert my forefinger and my middle finger after I lubricated them into the patient. And I would, as I was doing this, I would also palpate her where her uterus and cervix would be, and I would just try and palpate that while my fingers are in, trying to palpate the cervix, noticing any pain, tenderness, masses, anything abnormal for my female patient. So that would be my head-to-toe assessment and my discussion of the rectal examination along with the male and female genitalia and breast examination. Thank you.